Hi everyone, it's Jasmine, and today's video is about gastroparesis. So I hope you learned something today, and let's get started. So what is gastroparesis? Gastroparesis is a condition where the stomach cannot empty its contents properly due to impaired motility. This slows down or stops the movement of food from the stomach to the small intestine. The term gastroparesis comes from gastro, stomach, and paresis, meaning partial paralysis. As you can imagine, gastroparesis can result in a range of digestive issues, leading to poor nutrition and quality of life. Let's first chat about how the stomach works. With normal digestion, the stomach uses muscles and nerves to churn food and move it into the small intestine. In gastroparesis, the stomach muscles don't work effectively due to nerve damage or dysfunction, leading to delayed gastric emptying, aka emptying from the stomach. Causes of gastroparesis can include diabetes, when high blood sugar can damage nerves, affecting the function of the stomach, viral infections, as certain infections can damage the stomach's motility, neurological conditions such as Parkinson's disease, MS, and other disorders, as they can impact nerve function as well. Certain medications like opioids or certain antidepressants can slow gastric motility. And sometimes gastroparesis is idiopathic, meaning that there's no specific cause that can be identified. Symptoms of gastroparesis include nausea and vomiting, bloating and feeling full quickly, abdominal pain or discomfort, a loss of appetite, unexplained weight loss, and/or heartburn or acid reflux. When it comes to diagnosing gastroparesis, there are certain tests that can be done. These can include a gastric emptying study where you eat a meal with a small amount of radioactive material, and doctors will then track how fast the stomach empties. Endoscopy being a procedure to examine the stomach lining and rule out other conditions. A breath test, which is another test that measures how long it takes for food to leave the stomach. And electrogastrography, an EGG, which assesses stomach electrical activity. There are complications of gastroparesis that can arise if the condition is untreated or poorly managed. These include malnutrition due to poor food absorption, dehydration from chronic vomiting, blood sugar fluctuations, especially for those who are diabetic, bacterial overgrowth in the small intestine as well, which can lead to further digestive issues. And it's for this reason that managing gastroparesis is essential to quality of life. Now, some treatment options for managing symptoms of gastroparesis do exist. However, there is no cure for the condition. The treatment options to manage symptoms can include dietary changes, so eating smaller, more frequent meals and avoiding fatty or fibrous foods. Taking certain medications, such as those that promote stomach motility, for example, metoclopramide, or those that control nausea to prevent dehydration or electrolyte imbalances. It also can include gastric electrical stimulation, where a device is implanted in the stomach to help regulate muscle contractions. And finally, some surgical options exist for those severe cases where feeding tubes or even stomach surgeries may be considered. In all, living with gastroparesis is totally possible, but managing gastroparesis often will require ongoing medical care and regular monitoring of the symptoms. Lifestyle changes like meal planning, staying hydrated, and avoiding trigger foods, and psychological support due to the chronic nature of the disease, including possible counseling or support groups. Digestive disorder that slows or stops the movement of food from the stomach to the small intestine, causing symptoms that can greatly affect daily life. While there's no cure, early diagnosis, personalized treatment plans, and multidisciplinary approaches can help manage symptoms, prevent complications, and improve quality of life. Ongoing research, patient education, and increased awareness are essential to advancing care and support for those living with this condition. Thanks for watching.